So welcome everyone. Thanks so much for being here. We've got Roxie Danielson with us today, and she's going to tell us a little bit about what her role is and what she does as a frontline worker.
Great, thank you so much. So I'm a registered nurse. I work as a street nurse in downtown Toronto, and my work focuses on working with people who are homeless and people who use drugs. So we do a whole wide range of things as a frontline worker, as a street nurse. So I see folks both in the clinic and out in the community, in shelters and respite, on the streets, wherever folks need us.
Great. So what was the working climate for you like before COVID hit?
Before COVID, it was pretty bad as it was. So I found, especially with the folks that I was working with, there just really wasn't a lot of services for people, and access to care was pretty bad. So even just, for example, going to the hospital was really difficult for some people because they felt really discriminated against. Various services across the city, they again made people not feel welcome there. Now with COVID, it's become even worse because services, as most folks know, have closed down. So there really is even less places for people to go. So it's been really hard. As well, climate before COVID, the shelters were already full as it was. They were like 97% full or above when they should have been 90% or less per city council, which I believe was voted on in the early 2000s. So even just trying to get a shelter bed for people was really hard, but especially now with COVID, there's even less spaces for people. I believe there's about 1,000 less beds in the system. And so we're seeing more and more people sleeping outside.
And what was the shelter situation like? How did it change from, people, already an overcrowded, underfunded system to, when COVID hit and then we're supposed to be social distancing? What was that like?
That was really difficult. So at the beginning of COVID, I found personally, and I'm sure many people would agree, that the city really did not step up fast enough to create space within the shelter system to spread people out. Now the shelter is still quite full. And again, there's less shelter beds right now. And even when I had tried calling for shelter beds, and I know a lot of community colleagues are in the same position as well, trying to call for shelter beds, there still isn't anywhere for people to go. And that's why we're seeing more and more people sleeping outside. I know the city acquired hotels for people to stay in, but even with that, like, people were moving from various hotels. Some hotels have since closed or are closing, and then people are once again getting shuffled to other places, and that in itself is like quite traumatic, actually. So it's just a really bad situation.
Yeah. People are moved from being close to where their friends are and their resources are,
Exactly.
and dealing with the pandemic. So we've got these rules that we're trying to abide by, let alone people who are marginalized and who are dealing with trauma every day. It's just really upsetting and disturbing how the city has dealt with this. And as a frontline worker, I'm sure it's been tough for you. And I think about, if you could talk a little bit more about like, what is pandemic pay and what are the problems that you have come across with pandemic pay?
So pandemic pay is a top-up of pay for frontline workers because we're working in a dangerous environment with COVID. I myself, as a nurse, and along with many other community nurses, are not getting pandemic pay. So for us, it's a bit of a slap in the face, actually, because it essentially says some people are heroes. That's the term that the government is working. But then there's people like myself and other frontline workers, especially folks working in the community, that aren't even getting pandemic pay. And we deal with COVID on a daily basis. Like, there's been many situations where myself and other people have come across people who tested positive for COVID. And as I was mentioning before, I was doing outreach and still am doing outreach to different shelters and respites across the city, and like putting myself at risk, by going to other places, and yet we're not getting pandemic pay.
Right.
And it's been like quite a battle, actually. I personally have emailed Doug Ford and Christine Elliott. I've even seriously, and they didn't get back. I've tweeted at them. I've emailed the treasurer for the pandemic pay. I found an email online about it. I've emailed them twice, and I've heard nothing. We've contacted various unions to help support us to get pandemic pay. We've contacted the Association for the Family Health Teams of Ontario to help support for pandemic pay, but nothing. And at this point, I'm really sure don't know what to do. And I also feel for my other community colleagues at other agencies that also aren't getting pandemic pay.
Right.
And then just a note about gentrification, what you were talking about just prior to that, I agree. People keep getting pushed further and further out from the city. One point with the encampment, so since more people are staying outside right now, we're seeing more people living in encampments. There was initially a moratorium on evictions, but now people are starting to get evicted from their encampments and getting pushed into hotels. But some people, for like very good reasons, don't want to stay in hotels, whether it be because they don't want to get COVID, whether it's safety, or just somebody's right to choose whether they want to be in a hotel or not. And because of that, people are now starting to stay in encampments that are a little bit more hidden, and so it just makes it difficult to follow up with people, which can be quite dangerous, right? And even recently we had the heat wave, so trying to find folks to get them water is really difficult. And during the heat wave, the city only opened up 3 cooling centers and then pared it down to only 1 cooling center. So where's the access to get people to cool spaces and to water? You know, it's been really difficult, and it honestly seems like the city is like purposely turning a blind eye to all these issues, you know, and we have the Encampment Support Network, like a group of volunteers that have been going out and delivering water to people during the entirety of the pandemic. And even the Street Nurses Network, we've been trying to organize on our own time to deliver healthcare to people in encampments because the city just hasn't stepped up, despite so many of us, like you and I and other advocates, speaking out on the issue that we need more support for people who are homeless or people that are living in encampments. And then because we're in a housing crisis and gentrification is like happening rapidly across the city with all these new condos that are being built, people that do get housing are getting pushed away from the downtown core, away from their communities, and away from really important services. Like, it's so horrible.
Yeah, it has been, and it was brutal, I guess, before the pandemic. So now, if we don't have, like, we're relying on people in the community to help people survive.
Exactly.
Like the city, you know, they're just not, like you said, they're not stepping up.
They're not stepping up, and I find they're also just not responding in general. Like, when we do try to contact them, like via social media or email or what have you, like, they're not even responding, you know? And it's like, we're the ones doing the work on the front lines. We're seeing what's happening, and yet the councillors aren't doing anything about it. And neither is the mayor. And it's really discouraging, you know?
Yeah.
And first and foremost, I really feel for, you know, people who are homeless, and like this directly affects them. But then for us frontline workers, like, the burnout is so high because we're putting in so much extra effort into our work and then not being heard from our elected officials.
Right. Yeah. So you're trying to you're dealing with that trauma. You're dealing with having that work constantly.
Exactly.
With limited resources because you're not getting that government backing or political backing at all.
Exactly. And something I always share with people, so in nursing school, we learn something called social determinants of health. So they're the social factors that affect somebody's health. And one thing nursing school doesn't teach us is politics being a social determinant of health. But now whenever I talk to nurses or nursing students, that is like the first thing I talk about is how politics affects somebody's health. And like, this is a clear case of that. Like, our elected officials are not doing anything to support people who are homeless, and thus, or to help the housing crisis, and people are dying because of it. Like, politics plays a direct link to somebody's health. And it's something like we don't always consider, but it is what it is.
Right.
You know?
And that's really good to point out, because a lot of people aren't sure what to do, or they're like, does voting matter? Or, oh, that candidate looks great, but they have no idea what those policies are.
Exactly.
They have no idea how, like, for example, how John Tory is the perfect poster boy for photo ops, but his policies are completely opposite from what he says. But people are like, oh, you know, he smiles a lot, or
oh God, I know.
It's like you've got to look into what their policies are, because it literally affects people's lives. Like, it's so
absolutely. Absolutely. And even when we look at the overdose crisis, which is another public health emergency, like Doug Ford last year put a cap on the amount of safe injection sites in Ontario to 21, you know, and we still don't have drugs that are decriminalized.
Right.
Drug use that's decriminalized.
Right.
And we don't have a safe supply, but thankfully Toronto, I believe, has a pilot program at 2 sites that are going to start giving out a safe supply of drugs, which is really great. But it has been such an awful battle to get there, and so many people have died because of it.
Yeah, it's these small baby steps that aren't creating enough change. It's enough to, I guess, placate people, but not enough to create real change.
Exactly.
Like, what has it been like for you personally? Like, how have you coped? How have you dealt with this?
It's been really awful. I was even talking to my colleagues, and we're all just so burnt out. Even so, just yesterday, I found out another one of our clients died. He was somebody who was homeless. Just 2 weeks prior to that, 3 of our clients died, all of whom were homeless or homeless at some point. And one of the people who died was somebody that I worked very closely with for the last 6 years, and it was really, really difficult. He was an Indigenous fellow, actually somebody that used to come to the homeless memorial like quite often.
Yeah.
Anyway, he had health complications that required regular visits to the hospital, but unfortunately, because of COVID, the hospital wasn't being flexible about the times that he was able to go. And so his support people, myself included, weren't able to go to hospital with him at the designated time that they said he had to go to. And so we couldn't support him. On top of that, because he was Indigenous, he said specifically that he felt discriminated against at the hospital, and so he no longer wanted to go for his medical treatments. And unfortunately, because of all of that, he died. And he was 50 years old. He had just turned 50, so quite young.
Yep.
And it was just like a complete failure because of, well, racism, because of classism, you know, all of these things. And again, because he was homeless for such a large part of his life, like that really affects somebody's health. You know, in the last few years, yes, he did get housing, but unfortunately by that time, like the damage is essentially already done.
Yeah.
And it's just so sad. His death was preventable.
Yeah, these are preventable. Absolutely. Like, there's so much that can be done that isn't being done.
Exactly.
And I guess that's on top of the hardship that frontline workers deal with, you know, especially in the health profession, is that you're dealing with people who you've created relationships with. And so you're dealing with deaths and grief on top of, like, you don't have time to grieve. You don't have to, it's just.
Exactly. None of us do. None of us do. You know, and even at the homeless memorial that we attend, like every single month, there's more names added. And unfortunately, we know there's a lot more names that are probably meant to be added, but those are just the names that we know of that do get added.
Exactly.
Like,
that's
so
not
heartbreaking.
Yeah.
Like even just what I told you, 4 people died within the last couple of weeks. And in fact, a 5th person also died. He wasn't a client at our clinic, but somebody very well known to our community.
Right. Right.
Like, think about that. Like,
yeah, that is.
You know, and then so when we talk about people living in encampments, gentrification, you know, so people getting pushed further away, they're getting lost to follow-up, people getting moved into hotels. sometimes against their wishes. I know some people who really don't want to move into hotels, but they literally have nowhere else to go because all their stuff were removed at their encampment.
Right.
Like, people get lost, essentially, and they get lost to their support people.
Right.
And, like, that's really traumatic and really damaging. And I don't think the city, actually, I do think they realize it because we speak out against it.
Yeah, they've heard us.
I don't know. It's like willful ignorance.
Right.
Like, they're really turning a blind eye. It's so negligent and so dangerous what the city is doing.
Yeah, I agree.
And again, as frontline workers, we're the ones that are dealing with it at the expense of people who are homeless. Like, that's their lives that are at stake.
Right.
So it's really hard to deal with all of that.
So what do you think could happen going forward? Like, how do you feel about, maybe whether financial or emotional support or social support or policy, or like what is needed, and not just in the future, but like what is needed now for people who are working the front?
Yeah. Okay, what's needed for people for working the front lines, I think, that's such a hard question, because I think a lot of what we're experiencing is because of the public health emergencies that are happening right now. So the fact that we have a housing crisis and an overdose crisis. So those are the two biggest factors right now that are affecting our work and what we see on the front lines. Mm-hmm. So big picture, what needs to happen is a public health emergency needs to be declared, because we need all three levels of government to step up and help this crisis. So one, the housing crisis, we really need more affordable housing for people, because that would greatly impact our work. Like, if I knew my clients had a safe place to live, that would improve their health immensely, and that would take a huge burden off frontline workers, and thus taking a big burden of stress off. And then, of course, the overdose crisis. We need drug use decriminalized, and we need a safe supply of drugs in Toronto and in Canada and everywhere, quite frankly, because then, again, one less stress worrying, like, okay, is so-and-so going to die today in overdose because they don't have access to safe drugs. So big picture, I think there needs to be a public health emergency for frontline workers in the situation that we're in now. I think just more support at work. Like, if people need to take time off, I think that should be available. If we had, emotional support, counseling. Yeah, I'm not, it's funny, I haven't thought about what I needed, and I know, or as a frontline worker, and I know everybody, because we get just so caught up in the moment. Yeah. And I know when it comes to self-care, it is different for everybody. Mm-hmm. But for me, and actually I will say my workplace is amazing, and if I needed to take time off, they would allow me to do so, and we're really good about checking in with one another. So I think just normalizing the grief that we're all experiencing, and to say, like, it's okay that we're not okay, and that we need to take care of ourselves, and we need to step away from this work. I know for me personally, sometimes I do get so caught up that I'm like, I feel like I have to attend every meeting, or I have to do every action, or I need, putting more and more on my plate, because I almost feel guilty if I'm not doing it. So even just learning to say no at times, like, it's okay to say no, and it's okay to rest and heal. Mm-hmm. And I'm sure I'm not the only one that feels this way, because we just take so much on, because there is so much happening. So just being able to step back and be like, no, it's okay. Like, we need to rest. And knowing that there are a lot of us in the community that are fighting for better. Like, we are trying to advocate, for the public health emergency, for affordable housing, for safe supply of drugs, all these things that impact people. Like, there's a lot of us doing this work, which has been really amazing, and just connecting with each other has been really supportive. Incidentally, during the pandemic, I found I am more connected to our community colleagues, the community allies. I actually feel less isolated because of that. I know the circumstances aren't great, because we have our common goal of, like, fighting the government and trying to make things better, but truly, I felt so supported by the community. Like even yourself, like all of us, I find have been really good at supporting one another, even if it's something like small. But truly, that's been what's keeping me going, actually.
Right, right. Yeah, it's kind of like it's just what we're doing. Like it's important to knowing that people that I know are in these precarious situations, and like you just want to like make it better. Like I guess lastly, what advice for anyone that's watching this? What advice or tips do you have for ways that they could help, either with advocacy or any ways to take?
Exactly. Number one, write to our Prime Minister, our Premier, Mayor, City Councillors, asking to declare a public health emergency on the housing crisis and the overdose crisis, because those two things are the biggest things that stick out in my mind. Mm-hmm. Attending rallies, marches, showing your support with the community would be really important. If you're able to, try to speak out on social media, that we can create movement there. That could be really helpful for politicians to hear all of us speaking out. Joining advocacy groups can be a really good way to stay connected to people. Depending, there's, as a nurse, the ones that stick out to me, there's the Street Nurses Network, there's healthcare, HPAP, Healthcare Providers Against Poverty. There's the Shelter and Housing Justice Network, that you don't have to be a healthcare provider. And then there's like a plethora of other advocacy groups, but that would be what I would recommend.
That's awesome. Do you have, is there anything else that you think I missed or that you would want to address? Or do you think we've
I guess I just want to reiterate too that COVID has been really hard on the work that we're doing, and I know I've already emphasized this, but just that COVID might not be killing our folks directly, like people who are homeless directly, but I wouldn't say that we dodged a bullet. So at the beginning of the pandemic, we were worried that hundreds of homeless people were going to die because of COVID, and I think to date that 4 people died because of COVID. People who are homeless in Toronto. Mind you, that's 4 too many.
Yeah.
However, COVID has been indirectly killing people,
right,
in the sense that from what I've been seeing, people were delaying getting care because they were scared to leave their houses because of COVID. People weren't going to hospital because they didn't want to be exposed to COVID, but at times when they actually should have been going to the hospital. My client who needed medical treatment in hospital a few times a week, he, because of COVID, wasn't allowed to change the time when he could attend hospital. And then, of course, because of more people living outside and being pushed further away from the downtown core, people were losing their contact with their health support. And so that is also killing people. So there's many other ways that COVID has been affecting people's health without people directly getting COVID themselves. And just something to consider, like, I don't think we dodged a bullet. And I'm quite afraid of a second wave happening, as we all are, and I just think things are going to get worse.
Right. Yeah, it's realistic
and more reason.
That's the reality. Yeah.
And more reason. Yeah, and again, the overdose crisis. I think July saw the highest amount of overdose deaths here in Toronto. So again, because of service closures or rollbacks on hours, or again, people being displaced, being unable to get to safe injection sites, that's also been killing people. People who don't want to leave their home, or they don't want to use with a friend because they're afraid of spreading COVID to each other. Like, that's been really affecting people. Right. Because of borders closing, the supply of drugs coming into Canada and Toronto has been affected. And so what's being sold on the street is more toxic right now. So that's been really affecting people and causing an increase of deaths. So again, COVID is not killing people, but because of COVID, it is definitely, indirectly killing people. Right. Which is like really sad. And I feel like we're not really looking at that.
Yeah, the way that, 3 levels of government have moved the COVID rules and how much money they put into, you know, spreading the knowledge and doing all this stuff. And then, you know, other health emergencies are just like, oh, whatever. There's no real movement on that. It's frustrating. It's like we can pick and choose, you know, if there's a huge fire that's ripping people from their homes and that's something we need to address right away. You know, there are people who are homeless. Like this picking and choosing of what we want to focus on in terms of our health and in terms of caring about one another. That's what's frustrating, because the rest of us are screaming that there are all these other issues that are really important, that are all tied together and not being addressed. So.
Exactly. Yeah, exactly. And I mean, even just last year, remember Doug Ford tried to cut $1 billion from public health. Things like overdose prevention and disease management, and, you know, things like that. Like, that is who our premier is. And I know during COVID, people were praising him for certain things, but no, he is still trying to make all these cuts, which will directly affect people's health. And if he had his way, I'm sure he would be making a lot more cuts. But because of public outcry last year and people advocating and rallying, we got that cut delayed a year.
Right. Yeah, and that's what it takes. It takes people, a lot of people, to speak up against what's going on. Yeah. Well, I'm hoping that the people who are watching this have gotten something from this, gotten some information, are inspired to do something to help frontline workers, because it's not over and there might be a second wave. So I just really thank you so much, Roxie, for doing this interview.
Thank you for having me.
It was very insightful.